kids are dying.
The fight for and against masks tonight in Coeur d'Alene. Why some parents are furious with the school district's policies.
You then look around the region and there's just not 60 beds to care for even our school district, much less our surrounding neighbors. So it's a real problem.
And one North Idaho pediatrician is worried about COVID-19 guidelines in schools, why she says it is a real problem.
We saw temperatures in the middle 70s today, but I'm tracking even warmer weather with a lot of sunshine for this holiday weekend.
Good evening, everyone, and thanks for joining us for Krem2 News at 10. I'm Laura Papetti. Mark Hanrahan is off tonight. Well, school is heading back into session all over the inland Northwest, with Coeur d'Alene School District starting next week. The school board held a public forum tonight for community members to ask questions and to share feedback. And as we have seen for the past few weeks, protesters were in attendance tonight as well. Our Morgan Trow was in North Idaho at the meeting and says this protest wasn't like any others we've covered lately.
The Coeur d'Alene School District decided on 3 major COVID-19 protocols: no masks, no contact tracing, and no enforced quarantining. This is a stark difference from Washington school districts, even the exact opposite of what's going on in Spokane. And in Spokane, we're seeing a ton of anti-mask protesters, but tonight we're seeing the opposite. We are seeing pro-mask parents fighting against the anti-maskers. Governor Little, the Department of Health and Welfare, and doctors across the inland Northwest say North Idaho has a COVID problem.
We can anticipate from the Coeur d'Alene School District alone, approximately 200 children will require hospitalization for COVID. About a third of those hospitalized actually need an intensive care. So about 60 are going to need to be admitted to a pediatric intensive care unit, or PICU.
Coeur d'Alene School District had numerous COVID-19 outbreaks the previous school year, even implementing a mask mandate at one large high school. With the Delta variant now infecting and causing kids to be hospitalized, the school board has doubled down on COVID protocols, but not in the way you may think. Their spokesperson told me that there will be no masks, no contact tracing, and no enforced quarantines. That means if your child is exposed to the virus, you may never know. This is not sitting well with some parents.
You know, trust the professionals, trust the doctors, trust your nursing staff. I see Kootenai Medical Center making a cry for help, and we need to answer that. We need to be, come together as a community.
So what happens if there's a COVID outbreak in the schools? Well, Kootenai Health says with the hospital capacity being stressed, they will not be able to accommodate the influx of cases. School board members say they don't want to make a decision for the community, but some pro-mask parents say that not requiring masks is a deadly decision. In Coeur d'Alene, Morgan Trow, Krem2 News.
And tonight, one North Idaho pediatrician is warning that if school districts don't make changes, kids will be seriously at risk of catching and being hospitalized with COVID-19. So an issue that hospitals are facing, that there isn't just enough bed staff or medical staff to properly treat students that may become sick. Dr. Vanessa Carroll, the director of medical pediatrics at Kootenai Health, says a significant amount of kids are not eligible for the vaccine, and only about 40% being actually eligible based on the current data. Dr. Carroll says 200 or more children could end up in the hospital with COVID from the Coeur d'Alene School District alone. However, Kootenai Health does not have a pediatric ICU, which is where many students would have to go. Other hospitals in the region are extremely limited with both space and staffing.
The current information is about a third of these kids that are managing to get admitted need an intensive care bed space, and they need that higher level. Gosh forbid, they might even need mechanical ventilation to keep their lungs, expanding and breathing, because these are some rough viruses.
Social distancing, ventilation, hand washing, and staying home when sick are all important tools to help prevent this. Right now, however, the North Idaho school districts are essentially not following many of these protocols. As new case numbers rise, our local hospitals are making no secret of the fact that they are overwhelmed. Krem2's Whitney Ward had a chance to sit down and talk one-on-one with an ER nurse at Deaconess. She told Whitney they're doing the best they can, but says the strain is real and it's likely going to get worse before getting better.
Over the last 3 to 4 months, it seems like things have just been extra stressful at the hospital. Part of the problem is the hospitals are so full. So every day when I come in, we have 23 beds in the ER, and sometimes 23 beds are full of hospital admitted patients that are waiting to go upstairs.
People have so many questions when they hear about all the hospitals being stressed. What does that mean for you working in the ER day in and day out?
So we're trying to get really creative here to see how we can still see the ER patients.
What does that mean, getting creative?
We've made 11 hallway beds. Pretty much anywhere there's a wall and we can put a bed, we'll put a bed. And sometimes we see patients in chairs. We've created areas in the waiting room to see patients, also trying to maintain their privacy, of course, but we just got to get creative. We got to find space to see everybody and take care of them.
Do you think people outside in the community who aren't part of healthcare really understand how bad it is?
No, and I think what's really important, what I wanted the community to know, is it's not just our COVID patients. Like, yes, that's making things difficult. We're still recovering from last year, the shutdowns.
Is this the new norm?
I hope not, but I mean, it is going to be for a while. I mean, even when the COVID numbers go back down, I mean, we're canceling surgeries left and right to just try to control the flow and the amount of patients in the hospital. So we're going to be recovering from that for a long time.
So we've also heard about how dire it is in Idaho, North Idaho specifically. How has that played a role? Are you guys getting patients from across the state line?
I think yes. I mean, we always have, we kind of share our community because we're so close. I know as one of the lead charge nurses in the emergency room, every single morning I meet with every charge nurse of every floor. I meet with the OR team and we talk about how many rooms we have available, the outlying rural hospitals that need to send people in, and that's also challenging. Sometimes they don't have anywhere to go.
Do you feel that vaccinations are kind of the ticket out of this situation?
I think that the vaccination seems to be such a hot topic for everybody right now, right? I mean, I'm vaccinated. I feel like I'm doing what I can to help take care of people. I'm going to take care of people no matter what.
Because once they come through your doors, politics aside, right? I mean, you just want to take care of patients.
Oh yeah, definitely. And that's how it's always been. That's how we always believe. Every nurse feels that way. It doesn't matter what your health insurance is or if you have none. It doesn't matter what your political stance is. If you're vaccinated, we're here for you.
Is there anything else that you want people to understand about just what it's really like? You know, we're out here right now. It's a beautiful day. It doesn't feel scary in any way. But once you go through those doors, it's pretty serious, isn't it, right now?
It's very serious. I know personally a lot of the nurses are having a really hard time coming to work. I think one of our biggest challenges is knowing the care you want to provide, but not always being able to provide it because you're stretched so thin.
Okay, so talking about extremely high hospitalization rates, pushing healthcare workers, making them very stressed. So let's take a look at some of the numbers concerning COVID-19, specifically here in the Spokane area. The Spokane Regional Health District is reporting 224 people are hospitalized right now. 391 new cases were also reported today, with 2 new deaths. Across state lines, the Panhandle Health District is reporting 104 people being hospitalized with COVID-19. 309 new cases also reported today as well. All right, taking a look at some news surrounding those who are fully vaccinated in Washington state. Some new data showing you have a very low chance of catching COVID-19. The Washington State Department of Health released a report today explaining a new method of data collection. The new method identifying breakthrough cases by matching immunization information. Over the 4 million folks in Washington, there have been roughly 22,000 breakthrough cases, which means that's about 0.5% of residents have actually tested positive of those who are vaccinated. All right, lots of information tonight on what's happening around COVID-19. We're going to take a moment now and take a look at what's happening outside in terms of our weather. Definitely feeling a little bit more like fall over the past couple of days. And we have Michelle in tonight. Michelle Boss, Things are definitely starting to cool down. We're feeling that definitely in the overnight and early morning hours.
Yeah, we have. We've had some cool temperatures the last couple of mornings, but summer's not quite over yet. And as we head towards the holiday weekend, it looks like temperatures are heading back in the other direction and giving us some warm weather to enjoy. So let's take a look right away at the Labor Day holiday forecast, Labor Day Monday specifically. And it looks like it's going to be a warm one, a little bit more summer, mostly sunny skies and 84 degrees. So certainly something to look forward to. Temperatures are pretty mild out there right now, 60 in Spokane, in the 50s at Deer Park, Coeur d'Alene, Sandpoint, and in the upper 60s across central Washington, Moses Lake checking in at 68 degrees, Lewiston 66. Don't think it's going to be quite as chilly tomorrow morning as it has been on Tuesday, or at least it was on Tuesday and Wednesday morning. We do have mostly clear skies out there and expecting plenty of sunshine for tomorrow. In fact, mostly sunny skies and even warmer temperatures than we saw today by a couple degrees, 78 degrees, light winds, another gorgeous day. And then take a look at the weekend. Couldn't be more perfect. A little bit on the breezy side, but otherwise partly cloudy Saturday, 83, and sunny on Sunday, 85.
Michelle, thank you very much. 10:10 right now. This afternoon, officers responded to a shooting in downtown Spokane. It was at the Bank of America building. Now, when police arrived on scene, people in the area told them both the victim and the suspect had already left, so they were gone. However, officers were quickly able to locate the victim and transport him to Sacred Heart Medical Center. We're told the victim does not have life-threatening injuries. However, police have still not been able to find the suspect. And tonight we continue our Boomtown series covering the rapid growth throughout the inland Northwest. It is certainly no secret Spokane's housing market has skyrocketed. And as Ian Smay reports, a new study out there listing Spokane as one of the most overpriced markets in the country.
Alexis Reber has been looking for a house for 5 years.
It's really hard because we're, a 4-person family in a 2-bedroom apartment that's really small. We need a house.
Alexis lives in a 2-bed apartment with her 12-year-old daughter and 7-year-old son. She's been searching for a house big enough for her kids to grow up in.
Having a house, right now they're that age and they're sharing a room. It's like they need their own space. But we can't even afford to look at a 3-bedroom if you can even find a 3-bedroom apartment.
Time after time, Alexis says she's outbid by thousands of dollars in cash. She is frustrated as housing prices continue to rise.
We looked at a house 3 years ago that was sold for $180,000 and they resold it this year for almost $360,000. It doubled in price. The house is not worth that much.
A new study by professors from Florida Atlantic University and Florida International University may back up her feelings. That study looked at housing trends and current housing prices. It found Spokane housing is overpriced by an average of about 45%. Spokane is near the top in the nation, the 6th most overpriced in the country. Other cities near this range include Salt Lake City and Detroit. Boise tops the list. For Reber, one frustration with the market has been the speed at which houses sell.
I can barely afford a $300,000 home, and those houses are going within a week. We'll see a house that pops up, we'll go look at it, and they'll have showings for Saturday and Sunday, and by Monday it's gone.
People like Reber face a tough decision. Keep trying in a skyrocketing housing market or move.
We've even looked as far as Deer Park, and I don't want to drive that far to get to work, but if that's where a house is that we can afford, that's big enough, that's where we're going to have to go.
That is Ian Smay reporting. Women in San Antonio, Texas tonight protesting against new law that will ban abortions as soon as a doctor can detect a fetal heartbeat. Just a day ago, the Supreme Court voted to allow the new Texas law. The law would not have any exceptions for rape or incest victims, but allows the procedure for medical emergencies. The courts decided the request 5-4. All right, it is 10:13 right now. Coming up, we verify how long the vials of the COVID-19 vaccine can last before they go bad. And when we come back, we'll tell you how many vaccines are nearing that point of expiration.